So if you've got a sore neck, the easiest thing, the first thing that people often get you to do is called a chin tuck. So somebody figured out that if you imagine these are your little like vertebrae of your spine, there's little joints that go from one vertebra to the other. So sometimes they can get sore and inflamed, or you can get muscles that are really tight through that area and they get quite tense, or like some other kind of mischief in that area. So somebody figured out that if you can get those little joints to move like that and those muscles to open up, over time you can get more range of motion and actually start to lengthen all the way through there. So a chin tuck is essentially a chin tuck. So you imagine, a lot of the time they'll tell you to put your hands like this, and the reason for that is you want to keep your chin stable. Because if I come back like that, you imagine that kind of crushes those little joints. And that's a movement that we do quite often, so it's not stretching those ones. So by holding your hand here and making sure that you keep that chin going backwards, see how that lengthens all the way back through there, and it also lengthens through here. So if you do have a sore neck or some sore joints, once again, it's the repetition that helps it feel better. You're not trying to crush it through and then potentially cause an injury. You think about it like a rusty gate, you're trying to gently kind of ease it open. And the repetition puts more fresh blood through there, helps everything move better, and you should feel better by the time you finish. So with any rehab, you're meant to feel better as you're doing it, and then by the time you finish, you feel much better. If it starts to produce more pain or you feel worse after, please stop. This is more for education. Please check your healthcare practitioner. But you imagine like this, and then you start to come back. By the time you get to about the 10th one, you should actually be starting to notice that you can go a lot further. And then, nice and slow. You're not trying to go quick. You're trying to ease into it, making sure it forces all of those muscles to work, really opening that up through there.